I wanted to do a live today, but I wanted to do something a little bit more interesting about showing you what my personal issue is posteriorly. And it's a pretty eye opener. So, if you want to pause and get to know this anatomy a little bit first. Okay, here's my. Oh, this is my demonstration of myself. This is not an instruction video to test anything. Now, why am I doing it? Because number one, I know anatomy very well. I know my body very well. I know what it can and can't do, and I can reverse engineer what's going on. However, this is going to add in a very interesting concept of healing position, proper home instructions if you do the PRP route. It is a depressing aspect, though, to know what's really wrong. So, meet my little homemade, as I've probably shown before. Believe it or not, I've made that. That's my interspinous ligaments, nuchal. Well, technically not the nuchal. And I did try to make my own arteries out of wire, but okay. Posterior membrane is going to be the discussion. And why do people not heal with proper PRP injections in the posterior membrane if you go to any doctor doing it under ultrasound, so to speak? And any ultrasound posterior membrane, where is that? It is going to be between the occiput and C1. So that is the large membrane band, also known as PAOM short. And that is the connection where you have the, say it with me, rectus capitis minors, the dead center ones. Some people call this the magic button area. You ever press in there and you feel better? Likely you have a posterior membrane problem. So you have an interesting 3-layer of the rectus capitis posterior minor muscles, the posterior membrane, the PAOM, and the myodural bridge. With that connection is amazing, especially you find this wisdom with a lot of SOT chiropractors who are very smart with this stuff. Oh, okay, forgive the misery, but as we walk, that pumping mechanism that also assists with spinal fluid flow, and there's a lot going on when there's a low axial angle and caused by the this particular area. So it's the rotation left that can irritate my occiput. So what many of us tend to feel is, obviously in the back, there's the vertebral arteries going literally through the posterior membrane, through the dura, into your brain, and then goes up pretty much right into, well, it goes right into the brain. Sometimes it actually goes in front of the brain stem, depending. Some people have them all over the place. And some of them actually wrap around the brain stem or the medulla, which is another crazy thing I could show you on someone's scan. So what am I testing here? So when we lay down in the bed, this is the problem when people have, you can get posterior injections or you can lay flat on your back. What happens when we hit the bed? What hits first? Okay, this hits first. Now, if we have this, what many people are familiar with is the styloid, which is not in this model, which I'm going to be adding them in. And they go right in, usually some of them come actually more to the sides of the C1. This is transverse process of C1. Say it with me. So the styloids will come here, and then you have this jugular vein that's right in front of each side. So now this is where people assume Eagle syndrome, but it's not Eagle syndrome. Just because the styloid hits the jugular vein doesn't mean Eagles. But there can be complications likely to the 3 nerves that come out of this same exact whole foramen of that jugular vein foramen. So you have 3 nerves, 3 cranial nerves, very important, vagus nerve being one of them. The noises. So I get the suck your tongue to the roof of your mouth, it'll make a bubbly noise. That's the kind of sound I get. Crunching noise, like gravel, cornflakes, a lot. And eye pain. Good Lord. Okay. So, don't cringe with me. I'm fine. Now, when we lay down, this is where this type of pillow, you can see the groove. This is a particular special pillow for necks. I don't use it, and I'll tell you why. Because when you have any kind of torn anything here, you especially have the spinous process of C2. When this gets lifted, what happens here? This will go more posteriorly. Okay? Then what happens more with the styloid or the jugular veins, they get pressed completely even more. And the skull can lift upward. And that's what happens with me. So, now I'm going to take a towel and I'm going to put this right at the base, which makes it feel a little bit better. Now this is above C2, not pressing C2 up. So it's preventing C2 from getting hit from the back for me. So now when I go down, I have a little bit more cushion here. Now the reason why I'm using this pillow is just for the demonstration. Okay. Watch this. So you imagine right here, we were talking about the styloid, jugular vein, posterior membrane. If it's torn, it's going to separate, drop the axial angle downward, cause problems. Compression against vagus nerve, hypoglossal nerve, or accessory nerve, problems. Depending on everybody's different in their anatomy. So that's why people suffer differently. It doesn't mean that problems are different. Problems that are the same, anatomies are different. I'm going to now, on the top portion of my head in the back, I'm pressing down like this. So imagine the axial angles here. I'm pressing down and it's literally lifting the axial angle upward. Ready for the magic? Now first let me show you something. It's so weird. You're going to love this. Alright, let me just take the thing out. Now I turn this way, right? Now you see how far I'm going, okay? Now ready for the magic? Oh wait, forgot to put this back here. Okay. Pressing in the back. Actually, I can do it with this hand. Hey! So weird. So, what could be happening here? So this will, obviously, styloids will go above, outward, open more room for the jugular vein, the 3 cranial nerves. Also, the massive proprioceptive nerves in the back, the mechanoreceptors in the back. Need I go scientific on you to all the types of nerve fibers that send crazy signals or sending none. When you get to this realization and you feel what you feel. Oh, there we go. I got it good now. Your face relaxes. Every muscle, you realize you were bracing this whole time. Now, mind you, this is why people tend to get, I'm just going to call it calcified styloid ligament goes down to the hyoid bone. There is a downfall to this, though. I'll tell you in a second. Because of this bracing, these muscles get so used that was it the stylohyoid muscle? I'm already forgetting. That gastric muscle, all those brace up, and then it creates this calcification of it because it's suffering. And there's not enough blood flow, fluid flow, keeping things away. The body tends to brace it up because it's overworked. Now, when I let go, my face already cringed up. There's my rotation. See, notice how I go up and almost protract my head? That's my turning. Press down. Perfect rotation. I'm going to sing a song called Centeno Bound. Alright, so, and I can't create a mechanism, so you see why some people who get injections don't get better, because they can't get into that position, because they go home, they lay down, boom, the axial angle drops, the tissue's so separated that the cells are flowing all over the place, they're not close enough to reattach. So I will be looking to invent something, I hope. I'm sure I'll come up with something. So, what was I just saying? Yeah, so I'd explain this maybe on something else. Maybe I won't even just keep recording this part. But so here's the downfall. That's what I wanted to say. The problem is when you have the tension where it's supposed to be, literally right in here, right here. It should be there, that's getting compressed tightly. Shall I even say the word compressed? Where it should be. And only in that spot. Me doing this, although it fixes that, but guess what it also does? Compresses the whole neck. So, as good as this feels, it's still not appropriate. I want to sleep like this. I want to hire someone to press my head in. So this actually, in the long run, will start to hurt and cause a problem, because I'm putting compression where it shouldn't be. So I can start getting pain, compressing nerves that shouldn't. As I mentioned, it'll start suffocating those. And I can even feel certain muscles not happy with this. So, but you get the idea. My rotation is back to normal, and that is beautiful. But limited rotation the second I let go, and I feel like I can talk normal. Like if you feel like your brain flows again. So what ligaments do I feel are at it? I don't think it's just the posterior membrane. It can be, because let's face it, the PAOM, if that's off, then what else is off? It's going to lift upward and then slide all the things past anterior forward, and then it can pull on those other cervical junction ligaments, the alars and the apical, the longitudinal ligaments. There's an anterior posterior membrane too that can get affected. Then it can affect the especially those transverse bands, and then those get overstretched, and then you now create AAI. Now sometimes when I do this compression thing, my heart will skip beats which means I am now affecting something that shouldn't be affected, so it's too much. So I let go and become miserable again. Now the dream of striking gold so we can all get treated. There's my lesson.